Wildfires do more than scorch area. They can have extensive, enduring impacts on human health. Picture a scene of wood crackling in a snug fireplace can create the impression that its combustion is less harmful than that of fossil fuels. However, wildfires, which is just another sort of wood combustions, can have adverse health impacts. Hi, my name is Helena. I'm an MD with a Master in Public Health from Harvard, and join me as we uncover the far-reaching effects of wildfires on human well-being. But let's first start with understanding wildfires better. Wildfires or forest fires are uncontrolled fires that spread across vegetation and forest areas. And climate change has been linked to an increase in severity and frequency of wildfires. As temperature rises and droughts become more common, the risk for wildfires also increases. And in addition, climate change can alter precipitation patterns, which can also contribute to a more severe wildfire season. So as we continue to experience these effects of climate change, it's necessary to be prepared for the effects of wildfires on human health. And before we dive into specific organs, let's look at the most immediate impact of wildfires, which is its impact on air quality. Forest fires produce smoke, and this smoke is a mix of gases and fine particles from burning trees and plants. It can contain chemicals like carbon monoxide, nitrogen oxide, or fine particulate matter. And being exposed to such high levels of fine particulate matter can increase the risk of hospital admission. And wildfire smoke is not only a local issue, it can actually travel really far. For example, when there are wildfires on the west coast of the United States, after a few days you can measure high levels of fine particulate matter on the east coast, and sometimes even the sky might be yellow-gray or hazy. And some of the smoke can even cross the Atlantic and pollute European skies. And how does this happen? It's jet streams and cross-continental winds that carry the smoke through far-away regions. So now let's look at the health impacts. Wildfires can have short-term and long-term effects on human health. It can affect the lungs, our heart, our eyes, our skin, and even our mental health. And we will now dive deeper into these different impacts. Our lungs are one of the first organs that gets in touch with air pollutants when exposed to smoke. And inhaling wildfire smoke can lead to symptoms like coughing, wheezing, and shortness of breath. It can aggravate medical conditions like asthma or chronic obstructive lung diseases, and is especially dangerous for children, elderly, and people with underlying medical conditions. Beyond respiratory illness, our heart can also be affected. And here we especially have to look at fine particulate matter, or PM2.5. If you would look at them under the microscope, these particles are about 1/30th of the diameter of one human hair. So they're extremely small. And once they reach your lung, they can cross the barrier between lung and your circulatory system or your blood vessels. And so once they entered your circulatory system, they can reach any organ in your human body. And as these particles don't belong in your human body, they can cause inflammation and oxidative stress. And through this, they can trigger heart attacks, strokes, and other cardiovascular events. So I told you that your lungs are one of the first organs that are exposed to wildfire smoke. To others are your skin and your eyes. And therefore, exposure to wildfire can cause irritation of these. This can reach from mild symptoms to severe allergic reaction. And last but not least, the mental health effects of wildfires. Because these events are traumatic, they can lead to stress, anxiety, depression, and sleep disturbances due to displacement and loss of property. And even years later, that's what a review published in 2021 showed. They found elevated rates of post-traumatic stress disorder and depression up to 10 years later in communities that have been exposed to wildfires. So you might ask yourself, how can I protect myself? The best way to protect yourself is to reduce your exposure to this harmful smoke. And you can achieve this by staying indoors, closing your windows, and using air purifiers. And if you really have to go outside, it's best to use an N95 mask. Cloth masks are simply not as effective as N95 masks in filtering out these fine particulate matters and pollutants, so really go for this N95 mask. And you can also check the air quality before you leave your house in your weather app on your mobile phone or on web pages like, for example, airnow.gov. And to briefly explain you the air quality index, it ranges from 0 to 500, And a score above 100 means that the air quality is especially harmful for elderly people or children or people with preconditions like diabetes or heart disease. And a score above 150 is harmful for everybody, no matter their health status. So to summarize, we can say that wildfires have a tremendous impact on human health. And the rise in wildfires is a stark reminder of climate change and how it affects human health. And there's evidence indicating a future marked by an increase in frequency and severity of wildfires, even more than we experience it now. So to protect our health and that of future generations, it's essential to address climate change head-on by reducing emissions and opting for sustainable solutions. You can actively contribute to improving the air quality in your community. Opt for eco-friendly transportation alternatives whenever possible. Take advantage of public transportation systems or carpooling with your friends and colleagues, or for shorter rides, go on a walk or take your bike. And lastly, don't forget your political being and support federal rules that limit the allowable level of fine particulate matter from factories, power plants, and vehicles. So thank you for joining me today. If you liked the video, leave a comment, push the like button, and subscribe. And stay safe, and see you next time.